Good afternoon, YouTube. This is Anthony Wallace, and I am from Dallas, Texas. I am a traditional naturopath and freelance writer for PCDI Healthcare and Consultants, as it says on the badge, on the signature. I'll make this pretty much short. My subject is on naturopathy, naturopathy, uh, homeopathy, acupuncture, and chiropractic. These fields that emerging fields, the pros and the cons in getting in this field. Okay, I've had technical difficulties, so I will go ahead and kind of make this short and quick and to the point. Okay, in naturopathy or naturopathy, you have several different approaches. You have two, actually. You have the traditional track and you have the conventional track. The conventional track, you attend a Association of Accredited Naturopathic Medical College. There's about maybe six here in the United States. Um, you go there for about 4 years after undergrad, so you do 4 years of undergrad and maybe 3 years, I'm sorry, of naturopathic college. When you graduate, you will be considered a candidate, and then you take the the NPLEX license, and then you're able to call yourself a conventional or NMD, which is naturopathic medical doctor. An ND or NP is a traditional naturopathic practitioner or someone that has not went through an accredited college here in the United States. These can be um, colleges that are not that they say consider diploma mill, but that's a little harsh because some are not. There are actually a couple that are out there that are actually teaching their students and conveying with their students over the phone or by email or something to make sure that they have what they need to be successful. To go to a naturopathic college, it may even cost you as higher as an MD degree. So you have to look at also, are there jobs available for this type of degree? Um, Texas is not one that's in favor of naturopaths, and I hate that, but they are considering only a physician to be an MD or DO. One thing about it also, indies are welcome definitely in the West Coast and especially in Hawaii, natural, type of places. The only thing that the indie really can do, to tell you the truth, is maybe, they can't do major surgery, but they can lance an abscess or a stitch. They can also prescribe certain meds, but they can't do triplicate meds. Triplicate meds meaning, morphine and you know uh, propofol and all these other different types of drugs. And, because naturopathy, it really does not have the philosophy to do that. It was really um, a philosophy based upon the natural environment, sunlight, good food, pure water, pure air, stuff like that. Homeopathy is a little different thing. They use poisons to, cure the patient. So, and homeopathy means same like illnesses. So, if I gave you the same drug for someone that has a cold or something like that, you will most likely have the symptoms if you continue to keep taking it. So, but once you stop taking the medicine, then all of a sudden the symptoms go away. Chiropractic. Um, you go 4 years of school and then 3 years and then sometime four, depends on the state. You go through that training. You have to bring in all your own clients. There's no clients pretty much provided for you. So all those techniques that you have to do them on people that you know or people that you bring in. That's teaching you how to start and maintain a practice. But at $140,000 a whop, for school, and the only thing that you get is an alumni list to call up and say, hey, do you need a doctor? No, it's kind of hard, when you're $140,000 in debt and you can't get a business loan. But and after all of this, despite of all the negativity with this here, I would say it is a growing experience. It's going to help you to get out there and fight for what's yours. I mean, if it's something that you truly believe in and it's something that you want to learn, go for it. I don't put anybody away from that, where you have some people are saying, as I said in the last video, there are worthless degrees. There is no such thing as worthless degrees. It depends on how you market it. It depends on what skills you're able to bring to the employers and what type of asset you're going to be. So, because an employee is an asset, so you got to make sure that you know what you're wanting to do with it. If you want to be self-employed, please, please, please get some marketing type classes, get some business classes going, so that way you can be able to be successful. Acupuncturist is by itself alone. If you're not in the West Coast in San Francisco, or where Oriental medicine is really the top provider, then you're in trouble. You're gonna have to maybe get another degree on top of that, because allopathic medicine still rules today. They still have third-party reimbursements, and they can actually draw money from Medicaid and Medicare. You can't. DCs can't. They're not covered on the third party unless they're in the West Coast. Being California, Hawaii, Oregon State, all these, especially, and in the southern portions too, because you have Arizona is one. There are several different other colleges and everything that's out there that you can try. I will say at the bottom there is a link to the naturopathic colleges that you can go to. The other videos that I saw, all the things they saying is come to us, and you can be able to learn this and learn that and be successful. It's not like that. You're going to have to bust your butt, get out there, find out which state will allow you to even practice, because the state doesn't allow you to practice naturopathy there, you're going to jail. Regardless of whatever, certificate or licensure you have on the wall, if you come to any state and they have not had any regulation board in that state, it's not welcome. But again, there are several other ones that are that you can go into and try to establish your practice and see how it works from there. But naturopathy, naturopathy, and chiropractic are pretty much cash only. There's no reimbursements for that. So I will go ahead and end this video by again asking you to subscribe, and also check out some of the links that I am going to publish here on this site. Take care and be in good health.